So today we're talking about gram staining. So this is the new procedure I'd like to bring into the clinic. So first of all, description of the diagnostics procedure or test. So gram stain or gram staining, also called Graham's method, is a method of staining used to distinguish and classify bacterial species into two large groups, which is gram positive and gram negative. Gram staining differentiates bacteria by the properties of their cell walls in regards to retaining the stain. So gram negative cells will stain red and gram positive will retain the crystal violet dye, therefore will stain violet. Gram stains are performed on biopsies or bodily fluids when infection is suspected. Also, gram stain is definitely seen as one of the simplest, least expensive and most useful among quick methods that are used mostly in microbiology for the differentiation, identification and classification of microbiological organisms. So the procedures is performed to produce information regarding the types of organisms that are directly present from the clinical specimen or from the growth on cultural plates. So gram stain will let vets determine whether a certain type of bacteria is causing the infection and what type of microorganism is present. This is why any animal who is suspected to have bacterial infection or actually is having one is a great candidate for gram stain testing. Next slide. So justification for the diagnostics procedure or test. Firstly, it gives quick results when examining smear, so bodily fluids or biopsies. It is simple and cost effective. It is the first step to detect an infection, so this makes an important difference for patients' diagnostics, treatment and prognosis. So the cerebral spinal fluid for meningitis and synovial fluid for septic arthritis are a couple examples. It is basically a key procedure in identifying an infection fungus. It makes a difference in the way we approach the treatment, rules in and out an infection, combination of infection and fungal disease, or just fungal disease. It is a tool in reducing the use of antibiotics based on the results of the slides. So the patient is not the patient is not unnecessarily treated with antibiotics if the slide stained and examined or method proves there is no infection. So when the diagnostics procedure or test is appropriate. So the gram stain is the most important staining procedure in microbiology. It is used to differentiate between gram-positive organisms and gram-negative organisms. Any patient with skin allergies, ear infection, masses, lumps, and gram staining of bodily fluid, biopsy, snot, wound, and skin. The test is appropriate to decide whether antibiotic treatment is required or not. So this will reduce the risk of antibiotic misuse and the risk of generating antibiotic resistance. Any contraindications of the procedure test. So it has significant limitations when used for environmental microbiology. So some bacteria is not stained with either dye using gram techniques and are not seen. Also, it comes with certain types of risks, so not all bacteria can be definitely classified by this technique. So this gives the rise to gram variable and gram indeterminate groups. It might lead to misinterpretation, depends if the staining technique wasn't followed. So the acetone left longer than 3 seconds, this will we'll see decolorization. Also, the age of the culture may influence the results of the stain. The technique is not for the purpose of distinguishing one type of bacteria from another, but to make bacteria more visible. It cannot identify bacteria to the species level, and for most medical conditions it should not be used as sole method of bacterial identification. This is where a culture is needed to identify bacteria. Also, overheating this likely lead to destruction of bacterial wall, therefore stain absorption will be affected, leading to inaccuracy of results. Next, we have the introduction of new equipment and supplies. So here I've just listed the materials required. So we've just got clean glass slides, the Bunsen burner, the microscope, the immersion oil, the lens paper, distilled water, just things like that. And then we've got the stains, which is the crystal violet, the grams, the ethanol, the saffron. So that's the primary stain, the acetone, and the secondary stain, things like that. Next, we've got how to perform the procedure test. So here I've just got a wee picture of 1 to 4 steps, and I've also printed out the how to perform a gram stain, which I've listed in the next slide, which tells us the method and results. So method, we've just got 1 to 9, so prepare the thin smear, air dry, heat fix for 3 seconds in a hot flame or 10 seconds under hot air. Dip in methanol for 30 seconds and let dry prior to staining. Place sides on a rack over a sink, smear side up. Apply gram crystal violet for 30 seconds. Wash with water, apply gram iodine for 30 seconds, decolorize with acetone and wash immediately with water. So this is the longer than 3 seconds will cause decolorization. Counterstain with saffron for 30 seconds, wash with water and drain or blow to dry. Examine microscophilia using an oil immersion lens, 100 times recommended. So the results will be gram-positive organisms retain the crystal violet iodine complex and stain blue-purple, and the gram-negative organisms are decolorized by the acetone and are stained red by the counter stain. Cells present will stain predominantly red. So next slide. Expected results and outcomes. So this is pretty basic and pretty easy. So gram-negative bacteria will stain again pink or red, and gram-positive bacteria will stain blue-purple. Next slide. So any follow-up that may be required. So needing the veterinarian to check up on what you've found on the gram stain slide. So gram-positive or negative. If bacteria has been found, a culture and sensitivity test will be required in order to choose the correct and most effective treatment based on results from the culture and sensitivity. If it's positive for yeast, do not prescribe antibiotics, but rather antifungus. Then follow-up would be needed to make sure the clinical signs has cleared. Otherwise, another gram stain will be needed to make sure secondary bacterial complications have not occurred. Reporting and recording into the computer once results are complete. That takes us on to the next slide. So how reporting and recording will be done. So I've just put in there a wee bit on quality control. So we always want to be checking new batches of stain and reagents to correct staining reactions using a smear containing known gram-positive and gram-negative organisms. So the report should include the following information. So numbers of bacteria present showing if there is many, moderate, few or scanty. Gram reactions of the bacteria, gram-positive or gram-negative. Then we've got morphology of bacteria giving us results being cocci, streptococci, rods or cocci basophilia. Also, if the organisms are intracellular, the presence of numbers of pus cells, the presence of yeast cells and epithelial cells. And then recording, so this will be done once we have the results on a gram staining recording sheet. We will record permanently onto client and pet's database on the computer system, so we can keep track of what amount and what they have had as antibiotics, or whether or not they needed antibiotics. Taking us to the next slide, cost to client and justification of the cost. So here in the next slide, we've got our cost justification sheet. So we've new equipment to purchase. We've added in the gram staining kit, the Bunsen burner, the microscope, and as well as the slides, the oil, the paper, the distilled water, etc. So purchase price for everything together was $3,500. This was expected to last 10 years. Cost per month, $29.17. Estimated use per month, $20. Calculated cost per use was $1.46. Charge to client per use was $2.63. Cost of consumables per use, $5. Anticipated waste expense, we sort of had an idea around $30. Calculated cost of consumables per use was $5.13. Charge to client per use, $9.23. Staff time involved in activity, we put around 40 minutes. Numbers of staff needed was 1, as it's a pretty easy diagnostic tool. Then we estimated $17 per hour per staff member. Staff cost per use, $6.80. Charge to client for staff hours, $13.60. And this took us to the end result, which was with equipment purchase. So cost of service to clinic was $13.38 and charge to client is $25.45. So we're just under doubling the cost to clinic, which gives us a good good income and positive. Yep. Any questions? No, we're pretty clear on all that. Yep, awesome. And then we have here, I've done my handout for the clinic. So we've done the gram staining. I've just added a couple of pictures in there, and so I've just put a few bullet points about gram staining. So again, the stain is the most important staining procedure in microbiology. So it's used to differentiate between gram positive and gram negative. Also, gram staining of snot, wounds, skin, so this is important to be able to see what we are treating. This helps us to give the best effective antibiotic, or to see if they actually need it or not. If it's affordable and has quick receiving results for clinic and owners, recorded permanently onto clients and pets database on the computer system, so we can keep a track of what amount and when they have had antibiotics, or again if they actually do need antibiotics. Thank you very much.